This video series gives funeral directors guidance and tips to improve the quality of occupation and industry items on death certificates. Now we will look at some common vague responses to the occupation question and how they can be improved to be more useful. It's important to get the most specific response you can. Here are some additional examples showing how to move from vague to more specific answers. A response of laborer is very broad and doesn't give much information. You may need to ask, what type of laborer was the decedent? They could have been, for example, construction laborer, laundry laborer, warehouse laborer, or an oil field laborer. For technician, a more detailed response could be a civil engineering technician, a dental technician, or an X-ray technician. Lastly, if someone says the decedent was a maintenance worker, you can ask, what kind of maintenance work did the decedent do? And offer examples such as groundskeeper, carpenter, or electrician. Remember, it's important to get the most specific response you can. If you get a vague response, ask follow-up questions to get a more specific answer. Here's a case scenario for occupation. You learned that the decedent worked as an engineer at a company that builds airplane engines. In this case, engineer is a bit vague, so it's better to clarify if possible. Sometimes, when we have detailed industry information, like aircraft engine manufacturing, we may be able to deduce the specific kind of engineer, but it's always better to ask. Ask, what type of engineer was the decedent? Based on the response, the occupation would be electrical engineer, and industry is aircraft engine manufacturing. Next, we recommend you view Part 4 in the series, which looks at common vague responses to the industry question and how they can be improved to be more useful. This video was produced by the National Institute for Occupational Safety and Health, delivering on the nation's promise, safety and health at work for all people through research and prevention. To learn more, visit www.cdc.gov/NIOSH.